Good afternoon, everyone. Uh, Today from Telemedicine NIMANS, we will be discussing on medical negligence cases. Yes, myself, Dr. Suresh Badadmat. I have done my MD DNB from NIMANS. I have done my PhD in law from National Law School. Currently, I am a professor and head of Forensic Psychiatry, Telemedicine Center. And also, I'm a visiting faculty at National Law School and State Human Rights Commission, Bangalore, and I have published these various articles, including in forensic psychiatry and various awards. These are my credentials. Today we'll be discussing on medical negligence, what is medical negligence, and steps in proving medical negligence, and what are the steps you have to take reducing the risk of liability. So before we move on, I would like to put a disclaimer that what we are discussing today, the discussion generated and the presentation done, here are just the guidelines. They are not the law themselves. And if you require any help, you need to ask for a professional legal opinion. And please do contact advocates if there is any issue. This is just an academic exercise with regard to medical negligence. So introduction about the medical negligence. See, as you know, doctor and patient's relationship. This relationship actually stems from the expectation of the patient or the client, we can say now. They expect that they are coming with a problem or a illness, they want a cure for his illness. Or if there is cure is not available, they would like to have a relief from their pain. Or else care. If the cure is not there, care. But the issue here is, and also they expect there should be no harm to be done. And this doctor and patient relationship was a relationship from the beginning, was considered to be very sacred, but over a period of time, it has taken a consumer form. The reason being is there is a service provider and the service receiver. And whenever there is a deficiency of services, then the issue of tort liability comes in. And if there is a services deficiency occurs from the doctors or by the hospital, then there is an obligation to fulfill by compensation or by liability, either by civil or criminal. With this, we will move on to understand how this medical negligence came into practice. See, the medical negligence first started from a psychiatric case. This case is basically starts from an important case which came in 1957. This is goes by Bolam test, which is accepted across the world in US or UK or in India. This test is considered to be a landmark English law. What happened in this case? Mr. Bolam was a voluntary patient and he was suffering from recurrent depression. So in one of the episode, he comes to the hospital, Friary Hospital. He says, I'm suffering from depression. Past, I had received ECT. Please give me ECT. And then the ECT was planned. And I'll remind you, it was in 1957, where anesthesia was recently, at that time, was introduced. So the ECT was given, where there were a group of psychiatrists who used to give ECT with anesthesia. There were a group of psychiatrists who gave ECT without anesthesia. So with and without. Since it was in 1957, the anesthesia was just introducing it. So this in Friary Hospital, they go ahead with giving ECT without giving anesthesia. In the first and second ECT, nothing happens. In the third ECT, he develops severe convulsions and he develops acetabular fracture. But he recovers from the depression. But since he has developed acetabular fracture, he becomes very annoyed and he says, you had admitted for curing me depression, but you have given me acetabular fracture. He goes to the court and says, there is a service negligence, there is a medical negligence, and there is a deficiency of services, and there's harm has been caused. This is the first time an important case which goes to the court. Till then, there was no cases against the doctors, for specifically speaking. And this was a landmark case. The judge is McNair, who suddenly realizes there is no cases against the doctors. And then there is a patient who is saying that there has been what we call it as a harm done to him, and he's asking for compensation. Now the judge doesn't know what to do. So what he does is he will call the experts, so-called experts, basically other practicing psychiatrists, to know whether the doctors, the psychiatrist from the veterinary hospital did the right thing. So when the experts were called in, some of the experts said we will use modified ECT, that is with anesthesia, and some of them said no, we don't use anesthesia because it itself is a dangerous than the ECT. Then again, Judge McNair got slightly, what we call it as confused, and then again he said no, the doctor has followed one of the protocol or the standard of treatment which was available at that time. Hence, he said, a doctor is not guilty of negligence if he has acted in accordance with the practice accepted as proper by a reasonable body of medical men skilled in that particular art. If a doctor reaches the standard of responsible body of medical opinion, he is not a negligent. Further, he also goes and says, if there are 2 or 3 prevailing practices, and if the doctor is able to follow one practice, and then he is not negligent. And in this case, the Judge McNair says the doctors from the veterinary hospitals, they are not negligent, and he says there will be no any kind of medical negligence has been established, and the Bolam's test was clearly formed, and that test is being used now also in Supreme Court of India, and still in various parts of the country and also various parts of the world. See, and to summarize, what is the Bolam's test is, in the realm of diagnosis and treatment, there is an ample scope of genuine difference of opinion. And one man clearly is not negligent merely because his conclusion differs from the other professional men. For example, there is a patient who is sitting in front of me, I may diagnose him as recurrent depression. But 2 days down the line, the picture may change, or another doctor may give a difference of opinion. He may say, no, he's not suffering from depression. He may be suffering from somatization disorder. There may be difference of opinion, but the amount of care, due practices, standard of care, what has been applied, which deals whether there is a medical negligence is there or not. So the true test for establishing negligence in the diagnosis, treatment on the part of doctor is whether has been proved to be guilty of such failure the doctor of ordinary skill. See, the word used is the doctor of ordinary skill would be guilty if acting and providing substandard care. So please understand this word. I will again re-emphasize, no doctor of ordinary skill would be guilty of if acting and providing substandard care. So that's what the wording has been used in the Bolam's test. So, but that occurred in 1957. But the later, something similar happened. Another test came in, something called as Bolito test. Please remember there is one Bolam test. Now we are talking about the second, which also starts from Bolito test. This is again, which occurred in 1997. That is after 40 years from 1957, 40 years down the line in 1997. Here is a patient, young 2-year-old boy, Patrick Bolito. He's been admitted to an hospital where he's having episodes of severe cough. So in couple of cough episodes, he goes into breath holding spells. To that extent, he develops severe breath holding spells to that level. They need these admitted to the ICU. And in one of the spell, they call the duty doctor who is on pediatric duty doctor who has been called. But since he or she was busy in the ICU, in the other casualty, he was unable to attend the patient. By the time they wanted to respond, the patient recovered by himself. So such 2-3 episode occurs. And in the 3rd episode or the 4th episode, in the severe bout, he develops sudden cardiac arrest. Again, the doctor do not attend him. But finally, unfortunately, the patient develops a severe brain damage and he dies later. Now, the family goes to the court and says, the doctors did not take care of my son, that is Patrick Bolito. Now, the question comes whether the doctors, that's the pediatrician, were negligent or not. Again, there was an issue telling that if a person is having severe cough and the person is going for sudden breath holding spells, which may lead to what we call it as cardiac arrest, there was some of the doctors said that usually we may consider for intubation. but some of them said, no, we may not do intubation, which may worsen the situation further, so that there is no treatment available. So again, if you look at the Bolam test, the pediatrician over the doctors were following one of the standard protocol which is available. But in this case, the court said no. The doctor, though they followed the standard of protocol which is available at that time, that either doing intubation or not doing intubation, that was not the issue. The issue was the court was very unhappy with the issue, and they said that though the body of experts said that there was no negligence, but the court held against the doctor. Simple reason is they did not examine the patient when the call was come. So the Bolam test was nullified. So the important lesson from Bolito test is the Bolam test stands on the expert's opinion and saying that the doctor was giving a due standard of care. But the Bolito test is a body of expert opinion which is given should be logically supported. So in Bolito test, it says that the duty doctor were supposed to provide, they are either they can do intubation or they need not do intubation. But the issue was they did not attend the case. That was the issue, and the Bolito test said whatever the expert opinion may say, but it should be logically supported and it should convince the court. Then only the Bolam test will be taken, otherwise Bolito test will be upheld. So to summarize Bolito test, if it could be demonstrated that the professional opinion was not capable of withstanding logical analysis, that means court should be able to be the what we call it as, although the body of professional opinion sanction the doctor's conduct, whether it had not been demonstrated to the judge or the court's satisfaction, the opinion will be squashed. The Bolam test will be squashed. Bolito test will be upheld. So we have Bolam test, another one is Bolito test. With these two background in test, we will move towards the professional negligence, or what we call it as medical negligence. Two important tests, one is Bolam test, another one is Bolito test. So what is defining negligence? Failure to use such a care as reasonably prudent and careful person would use under similar circumstances. This is again from the Bolam test, and Jacob Matthew versus State of Punjab, one of the Supreme Court, a landmark judgment. In that it has been used, even in Suresh Gupta versus Government of India, Government of Delhi in this 2004. Again, this case has been, this test has been utilized. So defining further, negligence is the breach of legal duty of care. This is the word used in legal language. But however, you can simplify and say it is a breach of standard of care. Suppose, as a psychiatrist, I owe a duty of care towards my patient. If there is a breach in that duty, then it will be considered as negligence. Who will define this duty? It is my professional colleagues who is going to define, or what we call it as expert opinion, or its standard of body. Like psychiatry, Indian Psychiatric Society gives guidelines. That guidelines I have to follow. If I do not follow those guidelines, yes, I am deviating from the normal course of practice. Yes, there is a possibility I will be charged with medical negligence. So the medical professional is expected to bring a reasonable degree of skill and knowledge and must exercise reasonable degree of care. The court do not expect highest or nor a low degree care and competence. That means you have to produce a reasonable degree of care. They don't expect you to provide high degree of care or a low degree of care, especially in the court of law. That is what the whole negligence stands here. So the important point is every doctor has a duty to act with reasonable degree of care and skill. The issue revolves around is what is reasonable degree of care and skill. So how to go ahead with understanding about negligence? See, negligence have four important steps. First one is duty of care. Breach in the duty of care. That means there is either I have done something wrong, I have committed something, or I am omitted something which I am supposed to do. That is breach of duty. And because of breach of duty, there is a damages has occurred. And thus this damage should be directly linked to the whatever the breach has occurred. So there are 4 points: duty of care, breach in the standard of duty of care. There is a direct causal link between the breach and the damages. And this damage should be directly linked to the breach of care. So now we will take one by one. So if somebody is charging a doctor, telling that there is a medical negligence, first and the foremost, he has to establish there is a duty of care existed between the doctor and the patient. Second one is the doctor deviated from the standard of care. That has to be proved. Because of deviation of the standard of care, there is a damages occurred, and the damages is directly related to the breach of duty. And this harm should be directly foreseeable, and then the compensation will be given. This is how the professional negligence is defined. So how to prove duty of care? The patient coming to a doctor, the slip, the prescription, or else any form of investigation written establishes there is a duty of care existed between the doctor and the patient. Anytime you can consider if the patient visited and you have given a prescription, that means that itself gives an evidence telling that there was a duty of care existed. But the duty of care, can a doctor refuse providing treatment? Yes, the doctor can refuse to provide a care, except in emergency. The doctor cannot say, I will not see you. In emergency patients, the doctor is mandatorily has to see the patient. It is because of two things. One is ethical obligation and the legal obligation. What is the ethical obligation? That is basically Hippocratic oath, where we have taken, we will provide care for a person who is in need. The second one is Permanent Kataria versus Union of India, in a case where the patient is met with an accident and the patient goes from one hospital to another hospital. A social worker takes the patient. Each doctor says this is a police case, we will not see this case. And ultimately in the fourth or fifth hospital, the patient dies. The social worker writes to the Supreme Court telling that what kind of law is this which defies fundamental right to life? During that period, the Supreme Court in this case said that every doctor in emergency situation cannot refuse treatment, cannot refuse that I will not provide any kind of care. So there we lose that power, the doctor's right to choose a patient will be lost. But however, in emergency situation, you are obligated to provide. If you are in emergency casualty duty, you cannot refuse a patient under any circumstances, whether it is in government, public sector, or in a private sector. You have to provide the care, because the Constitution of India, Article 21 is very clear. It is right to life and liberty takes the primordial situation. And now coming to the foreseeability, that is basically a standard of care. The standard of care will be judged based upon the available guidelines, available textbook, standard textbooks, or else the expert opinion. On that basis, they will assess the standard of care, whether the doctor provided the care or not. And because if there is a breach in that, what damage has occurred? And that damage should be foreseeable. I will give an example. If I am a doctor seeing a patient and his diagnosis is schizophrenia, and I will decide to give him 20 mg of risperidone. That is one. So one doctor has given risperidone 20 mg. Another doctor, Y or X, you can say Dr. X, sees the same patient, prescribes 8 mg or 6 mg to 8 mg of risperidone. Now, what does the clinical practice says? Who is negligent? If something goes wrong, if a person develops side effects, if it is in, the patient may develop tardive dyskinesia either in 8 mg or maybe in 20 mg. The medical negligence will be clearly seen if it is 20 mg has been given, because the standard of care or practices will be between 6 to 8 mg is the dosage, not 20 mg. Though 6 mg can produce the same side effect, but however, the 20 mg is not considered as a standard practice or a standard degree of care. So then the doctor will be considered as negligent. So this is how the negligence will be decided. Now the foreseeability. What was the side effect developed? The side effect developed was tardive dyskinesia, and that is directly foreseeable. So this will be medical negligence if a person is given risperidone 20 mg, develops tardive dyskinesia, and then he goes to the court. Suppose if the patient takes Risperidone 20 mg, and then he goes outside the hospital, slips and falls down. Now he says, because of Risperidone, I have fallen down, and there is nothing to do with, there was no indication to have postural hypertension or nothing, or else he is walking on the road, a vehicle comes and hits him, and he says, because of Risperidone, the vehicle has hit him. That is not foreseeable. It is an accident. It will not be compensated. That is what is foreseeability. Or else he is on Risperidone 20 mg. He develops a fever of other illness, or it may be because of viral infection or coronavirus, and he succumbs for that injury. And he says, because of 20 mg of Risperidone, he dies because of coronavirus. That is not foreseeable. The damage which has occurred should be foreseeable. That's what it is. Foreseeability has been brought in. So another important concept has been brought in is, this is the doctor has done. There is something called as contributory negligence, where the patient do not follow the advice given by the doctor. For example, the dosage. Suppose the doctor has told him not to take oily food. He has to do some exercise. He has to come for regular follow-up. He is being told to do some blood test. Suppose you are told him to do clozapine, hemogram monitoring. And if he doesn't do and something goes wrong, because of that it is foreseeable, risk is there, the contributory negligence is from the patient. And suppose you have given a medicine to the patient and you have told him not to take alcohol or other substances or cannabis use, and he continues to use in spite of your advice, which is documented very clearly, then the patient is contributory negligence will be considered. Even the doctor is negligent for some reason, and also the patient is also held responsible. If you are able to prove that he continues to take alcohol or he did not follow the advice of the doctor, then the negligence will be on the part of patient also. To summarize about the medical negligence, so the medical practitioner must bring to his task a reasonable degree of skill or knowledge, not high or not low. It is a reasonable degree of care. So that is what the Supreme Court has said. So the negligence may be civil or may be criminal. Civil means it's a compensation by the way of money. Criminal means the doctor will be punished in the form of imprisonment, or a fine has to be paid to the government. That is how the negligence will be taken into consideration. In Indian scenario, what are the different types of negligence will be taken? That's what: criminal negligence, civil negligence. Civil negligence can be two types: going to the civil court or to the consumer court. Nowadays, the patient do not opt for civil court because it's a lengthy procedure. They go to the consumer court. I request all of you to read about the recent amendment, and the new act has come, Consumer Protection Act of 2019. So it's a landmark act is there, which is a various amendment has been done. Or the patient may seek for the removal of license, Medical Council of India. Nowadays, there is a Clinical Establishment Act in various states, or a private clinical establishment. They can approach the various boards or else commissions. It may be Human Rights Commission, Women Commission, Child Rights Commission, or else the patient, especially with persons with mental illness, he may approach the Mental Health Review Board. Coming to the criminal negligence, where the patient has undergone any of these. Basically, the patient, the family feels the patient died because of the negligence. So 304A can be pressed against the doctor. And that is basically gross negligence should be there. That means the person, because of the rash and negligent act of the doctor, which caused death of a person. And that gross negligence is very important. Though the 304A gross has not been defined, but in various Supreme Court judgment, the gross is to be so severe that the person's death was inevitable, and the doctor was so callous and negligent, it strikes on the face. So that is the way it has been defined, and it will be taken by cases. And Section 336 is rash and negligent, endangering somebody's human's life. It's not causing death. It may be grievous injury or a simple injury. That is 337, Indian Penal Code 337, 336. Those are the cases. But invariably, if there is a death, 304A has been used. So in this regard, especially in a death of a patient, there are two landmark judgments. And I would recommend you to read both if possible. Jacob Matthew versus State of Punjab is a best example where our Supreme Court has given a beautiful guidelines. They have done an amazing analysis in this case. In this case, Jacob Matthew versus State of Punjab, a elderly man who is suffering from a terminal cancer is taken to the doctor, and the doctor, basically the Dr. Jacob Matthew says, see, this person is almost terminally ill, we cannot do anything. But however, the family says, please admit him. The last days we are unable to take care of him. Can you let him be in the hospital? So finally, the hospital agrees for his admission, and they continue to treat. It's basically what we call it as a last, what we call it as maybe auspice care, what we call it as, or we call it as where the end of life care, what we consider that kind of care was given. And in one early morning, what happens is the patient starts gasping. And the nursing staff finds that the person is gasping. They call for Dr. Jacob Matthew. Dr. Jacob Matthew is not reachable. Finally, the duty doctor is being called. After 10-15 minutes, the duty doctor comes, and he goes and he brings the oxygen cylinder. He tries to open the oxygen cylinder. Unfortunately, the oxygen cylinder doesn't work. By the time they bring in another oxygen cylinder, they try to fix, the patient dies. Now, in this case, the Dr. Jacob Matthew and his team is being charged under criminal negligence, and the case goes to Punjab, State of Punjab, and then goes to the Supreme Court. In this case, the Supreme Court was very clear, and it says negligence is an essential ingredient of the offense. The negligence to be established by the prosecution must be culpable or gross, and not the negligence barely based upon error of judgment, or what we call it as just because the cylinder was not there or the cylinder oxygen was not there. Doctor cannot be charged with criminal negligence. And in this case, the Supreme Court, in the same case, the doctors were arrested, and a lot of public outcry occurred, and then the doctors started becoming defensive. The Supreme Court was very, very, what we call it as supportive towards the doctor, and came up with the guidelines for arresting doctors in case of criminal action. What is the guideline? It says, if there is by chance a criminal allegation of negligence is there, there should be a prima facie of evidence. And the person, if there is a death or some criminal, what we call it as a grievous injury, the patient or the family has to go and complain to the police. Now, the police has to, before they do anything to the doctor by arresting, they have to collect the evidence in the form of collecting the medical, if there is a medical records, take the medical records, whatever investigations, they have to collect it. If there is a death, they have to take the body into their custody. The body has to be, postmortem has to be done, take all the reports, and that reports has to be submitted to a competent medical board, maybe in the government, usually in the government, or into a medical council. That medical council will examine the available evidence, and they have all the, they can also call the person, the doctor who is accused, ask for his explanation, and also find available facts, and then they may say, yes, there is a medical negligence is there, then only the police can go and arrest the doctor. And again, the doctor need not be arrested if he is available there, and there is clearly he is not going to escape from that place, and is not going to come in the way of the investigation, or he will not create any trouble. The bail can be granted, and the arrest should be the last resort. That's how the Supreme Court has put across. So these guidelines have been notified in 2005 only by the Supreme Court. So especially in the criminal case, the court has been very, very generous towards the doctor. In the similar, one of the important landmark case which has occurred in 2012, Kusum Sharma versus Batra Hospital. Again, here is a young man who is suffering from abdominal pain and also generalized swelling of the body, legs, and he has edema of the legs. And so he goes to the hospital, and in the hospital, when they do a ultrasound scan, they find that there is a mass on the adrenal gland, and they would like to do a surgery, and they'd go ahead with the surgery and find that the adrenal gland has a cancerous tumor. And by the time the patient develops complication in the form of fistula, and then finally goes from one hospital to another hospital, and he develops complication to that level, he has to, the fistula has to be drained every day. The patient becomes very unhappy with the care. Finally, he ends up in All India Institute of Medical Science, and then various other hospitals, and finally he dies. his wife goes to the court and says that the first hospital did not provide proper care. Because of that, my husband died. This is how she goes and argues against the hospital. In this case, the Supreme Court again has given a guidelines how the medical negligence has been treated and how it has to be taken care. So there are important 6 points. I will run through the 6 important points that will give you a sense of how the Supreme Court has been generous, though the society has been against the doctors, especially in various forums, especially in the contemporary world. Negligence, this is the Supreme Court words, negligence is the breach of duty exercised by omission to do something which a reasonable man, guided by those considerations which ordinarily regulate the conduct of human affairs, would do, or doing something which a prudent and reasonable man would not do. This is one of the point which the Supreme Court has said. A medical practitioner would be liable only if his conduct fell below that of a standard of a reasonable, competent practitioner in his field. The medical professional is expected to bring a reasonable degree of skill and knowledge, which I have already told earlier. Again, the Supreme Court in this case also emphasized on that. It doesn't expect a higher level of care or the lower level of care. And also, negligence cannot be attributed to a doctor so long as he has performed his reasonable degree of care has been given and the competence has been done. In the realm, suppose if there is a genuine difference of opinion in the diagnosis and treatment, that cannot be held as a medical negligence. That is very, very essential, because medical, first, if there is a person who comes with a fever, there may be 10 diagnoses. And you need not wait for the diagnosis to be confirmed. You will start treatment because the person is in pain. You have to relieve his pain. So in this realm, you may assume this may be the diagnosis. You may start the diagnosis and the treatment. You may do a provisional diagnosis. So there is a genuine difference of opinion is not a medical negligence. And also, if there is an error of judgment, cannot be considered as negligence. This has been told many times by the Supreme Court. So negligence is an essential ingredient of an offense. The negligence to be established by the prosecution, and it should be culpable and gross, especially in the criminal case. And in civil case, it is more of what we call it as a probability of the evidence. That I'll come to it, probability of evidence. So especially in India, especially the judiciary has been very liberal with regarding to criminal case against the doctor. But however, in civil cases, they are being serious, because the general perception of the society, general perception, I'm not telling, general perception of the society and the population says that doctors are making money. Hence, the court are taking a harsher civil punishment. But in criminal cases, it will be the doctors have been they are not doing any kind of thing which is causing a gross negligence. That's how the court has been taken. In civil cases, it's basically either civil court, consumer court, MCI, that is Medical Council of India. Now it may be considered as NMC, National Medical Commission, and various other commission I have told. The last case I would be discussing is on civil negligence, which is very essential because which is one of the landmark judgment by the Supreme Court. It is Kunal Shah versus AMRI Hospital 2014, where a huge what we call it as compensation has been given up to around 12 crores has been given. In this is a very case which can be discussed. This is again in 1998, the husband and wife, that is Kunal Shah and his wife. Kunal Shah is a pediatrician, I think, if I'm right, and also his wife is a child psychologist. They are working in US. They come down to India, and during in Kolkata, I think she develops rash within 2 or 3 days, and she presents herself in front of a doctor who diagnoses there is some rashes on her body. It is because of some kind of allergic reaction. He writes methylprednisolone, and he gives certain medicines. And then within 2 days, it doesn't improve. Again, the depot injection have been given twice a day. And again, it doesn't improve. By the time the doctor goes out of station, and this patient has been handed over to somebody else. And unfortunately, the situation worsens. She develops toxic epidermal necrolysis. She has to be admitted to ICU, and they will give various other medications. She doesn't improve. And further, she has been, since her situation worsens, supportive treatment was given to some extent. But however, the court has taken to your various notes. She was taken to Mumbai, and finally she expires on 1998. Now the husband goes to the court, both in the criminal case, civil case, and also to the consumer forum. The criminal case was on the doctors were squashed, telling that there was no gross negligence, but however, they considered it as civil negligence. In this case, the medical negligence quantification, the quantification of evidence, that is what matters. The evidence for a gross negligence in criminal case is beyond reasonable doubt. Whereas in civil negligence, it is the probability of the evidence. Who provides more evidence for medical negligence, that person will win the case. That is called as probability of the case. In this case, they assessed like this. The compensation was assessed on the basis of expected years of life of earning. If that lady of the Mistress Kunal Shah's wife was, if she's expected year of earning, leaving what she was earning, and then this is a rough estimate I have taken, divided by 3, that means 1/3 will be used, whatever I earn, 1/3 will be used for my expenses, and expenses towards the case, travel, loss of care, interest on the amount since the number of days, and finally they gave a huge, something around 6 crore, and with interest it became a 12 crore. So in this case, it is very clear the courts have been generous with criminal case, but however, with civil cases, they are very clear. They have a general perception all doctors are making money, hence we will hound them in civil cases. That's how has been looked up upon. So, but now going to the last part of my presentation, reducing the potential liability. First and the foremost, you have to be very clear. You have to take whatever issues requiring license, registration, and whatever no objection certificate, all those possibilities, fire safety, biomedical, please take all those required registration. That is very essential for a practice. And also maintain open and honest communication with your colleagues and also with the clients. And please follow standard of care, reasonable degree. Nobody is expecting high or very low degree. Maintain the what we call it as records. It's very essential. And also learn and attend various case conferences so that you learn you are in the reasonable degree of care. Document properly. If care is not documented, it has not been done. That is how it has been considered. And attend relevant continuing education classes. So to conclude, in my medical negligence today's class, doctors are allowed to do mistakes, and all mistakes are not considered as negligence. Negligence by doctor has to be determined by the judge who are not trained in medical science. So what they usually do is either they take examples from the previous cases or they ask for expert opinion. So the expert opinion says that reasonable degree care is taken, then the Bolam's test applies. But it can be contested that Bolam test does not withstand the logical analysis of the court. It can be rejected also, which becomes a Bolito test. And finally, the medical professionals are entitled to, this is the Supreme Court words, the medical professionals are entitled to get protection so long as they perform their duties with reasonable skills, competence, and in the interest of the patient. The interest and welfare of the patients have to be paramount in the medical professionals. Thank you very much. Please, you can ask questions. I think it has been slightly a longer discussions. So please go ahead. Any questions?
Doctor, that was an excellent presentation. My name is Dr. Criado. I'm speaking from Mumbai. I am a psychiatrist who practices in a private setup. I was wondering, in terms of patients following up,
okay,
we often tell patients follow up, within a month or within 3 months.
Yep.
What will be a reasonable standard of care if the patient fails to follow up despite repeated reminders? And keep saying that they're well and therefore they don't need to follow up if something should go wrong?
Okay.
Thank you.
So that it's like this. If you have told them that I have to monitor you and you document, please follow up within 1 month. So usually that is the reasonable degree of, like, suppose if I am starting lithium, I would like to see them after one week to know what is the levels, if there is any side effects, and serum lithium will have to be done. So within 1 week, they have to present themselves to me so that the serum lithium will be checked again, and then I will optimize the dosage, which is the requirement. Any professional psychiatrist will advise the same thing. If they don't present to me on after 1 week or 2 weeks, something goes wrong, invariably the doctor will not be considered negligent, because you are clearly documented. They have to come with the blood report. This is how it has to be done. So that's very essential. Documentation of telling that you have to come for after 1 week because of this reason. And that requirement is very essential. So you may ask for close-up in every month. If the patient is on close-up in, you will write there, please follow up after 1 month with hemogram. And there is a possibility of hemogram falling down or WBC count falling down. If you're able to explain and document, if they don't turn up and tomorrow after 3 months or 4 months down the line, if he says, I have developed side effects and WBC count has come down, then you can say, I had told you to come after 1 week so that I can monitor you, and you did not turn up. So the contributor negligence goes on the patient, and the doctors invariably will not be held responsible. I hope I answered your question.
Thank you.
So please document that, telling that, please, like suppose you are treating a patient with alcohol, right there, do not take alcohol, first treatment. That should be our advice. Second will be the medicine. If you are starting olanzapine, you have to mention avoid oily foods, exercise, yoga, or that kind of prescription has to be written, so that if they doesn't follow, you can say that I have told you 1, 2, 3, 4 and you are not followed 2, 3. That is very essential, so that the prescription is clearly written. So if there is any negligence, which will be contributory negligence by the patient, if he doesn't do it, then it can be held responsible. In psychiatry, there are no much, but especially in surgery, I have to tell the patient, this is how the wound care has to be taken. And if we are discharging him after 1 week, he goes, if there is unhygienic situation and he gets infected, and especially if it is orthopedics and he develops osteomyelitis, it's a huge problem. So they have to document, and they do document, telling that this is the aftercare treatment has to be done, and how he has to take care will be documented. And that is very essential, and it's a very good question. Thank you. Okay, Aleem has raised hand. Aleem, go ahead.
Yeah, sir, thank you. It was a very lucid, very nice presentation, sir, as usual.
Okay.
And it was exceptional today and very useful. Sir, just a few things. Suppose I have seen people making stamps. Stamp may they write that do not drive, do not take alcohol. You have a printed format. Do not get pregnant without informing the doctor. Suppose these sort of precautions that are usually followed. I make a stamp or I make a printout on my prescription. So how does this help in this negligence and this thing?
Okay, actually, it's just not printing. You have to inform the patient. For example, even in NIMANS, in the prescription, it is clearly written, if you develop any side effect, stop medicine, contact near medical practitioner. It is nearest medical practitioner has been written. So these kinds of, you print it, tick down and explain them, then they have to follow that. The patient has to follow that. It is for the safety of the patient we are writing it or printing it, and you have to explain them why we have written that. So that definitely helps you, Dr. Aleem. And I would prefer that on the back of the prescription, you can, for example, if I'm starting clozapine, I would write to print it out that if you're on clozapine, for especially, please do hemogram monthly, report to the doctor. WBC count will maybe you have to be in this zone, that you can print it, and that definitely plays very important, what we call it as a document for the education of the patient, and also it can be used in the court of law that there is a document like this. But unfortunately, if the patient is illiterate, you have to explain, and you have to write down telling that it has been explained to the patient in their language. That is very essential. Like if I have printed in English and the patient doesn't know English, then you have to tell that this above points have been explained in Hindi or the language what he knows. So that is very essential, that the communication has to be shown and to be documented. That's what Aleem makes important.
That is a savior. That is a savior in negligence case.
Yes, definitely.
Sir, one more thing.
Yeah,
suppose a patient comes when the clinic is closed. I'm off the clinic. I'm standing outside the clinic. And it is an emergency case. I'm not on duty. So what is my responsibility? Should I attend him when I'm not on duty? Or what do I say to him?
Okay, see, this is a very tricky question. I do get this question in National Law School very often when I go to teach there in postgraduate diploma in medical ethics. See, in Hippocratic Oath, we have taken very clear during emergency. It doesn't say that emergency doesn't mean that I have to be on duty. And if there is a patient falls in front of me, it is my ethical obligation and also legal obligation, what best I can do. Like, I don't have anything, but I have to do first aid. Do ABC and try to refer him to the nearest, call the ambulance, or accompany the patient to the nearest hospital, drop him. That courtesy has to be done. We can't just walk away from that place, because we are a responsible, what we call it as citizens in the, what we call it as in the country where we have taken ethical oath that I'll protect the patient's life. And that is one hand, but at the same time, the Constitution says right to life and liberty as a fundamental right. And we owe a duty to the fellow citizens. So if you ask me, it's not only the duty of a doctor and a duty of a citizen also. Imagine he is not a doctor and a citizen is standing next to him and a person collapses. It should not walk away from that place, because we also have something called as, though the fundamental rights have been given in 1950 when the Constitution was written, but unfortunately we wrote the what we call it as fundamental duties have been there, that we are responsible for the fellow citizen. What kind of responsibility? Calling the ambulance, shifting the patient, that has to be done. Unfortunately, we talk about rights, we do not talk about duties for even citizen, but this is the saddest part. But yes, we owe a duty, Dr. Ali.
Yeah, sir, one last thing.
Yeah, go ahead,
If you
Ali.
allow.
Yeah, please go ahead, Ali.
Sir, suppose in the college there are suppose 100 patients in the OPD. Junior resident is working up, and some patients are seen by the senior resident, some by me, some by the consultant. So in 100, suppose we have to finish OPD before the academic starts. So there is a rush. The time to see a patient is reduced. It is distributed between the JR who is initially working up the case and the consultant who is finally taking up. So suppose most of the things have been worked up and consultant sees the case for 2 or 3 minutes and something wrong happens. So how is this time duration quotable in a negligence suit?
See, though if you look at one of the best case which has been very well discussed is again in the Supreme Court, Samira Kohli versus Dr. Prabha Manchandana in 2010, the National Consumer Forum, and then when it goes to the Supreme Court, a beautiful discussion has been done. It is, I think, around 80-page judgment. They acknowledge the current scenario of the doctors working in various public institution, private institution, and wherever the services are given good, the number of patients is huge, because there is a huge difference. See, in that scenario, that cannot be used as a defense, because a reasonable degree, because what, like suppose Dr. Alim is sitting in a clinic and he says that I was seeing 100 cases and in this case I could not give attention and the patient, something happened. Immediately they will ask the another doctor, if you are in that similar situation and similar case comes, what will you do? And the expert will say, I would do ABCD. And they will consider it as a negligence. So you seeing 100 patients will never be taken into consideration, because it is the standard of care which matters. Because it is in your hand to see number of cases. How many cases you are going to register in OPD is left to you. But unfortunately, in the public sector, we do not have that kind of what we call it as.
We cannot refuse many patients.
Yeah, many patients. But however, in various hospitals, government hospital, they started putting a cap telling that by 11 o'clock we will close the registration. Only first 300 cases will be taken for registration. Only then they will stop the registration depending on the availability of the medical doctors available there. So already the practice has been started. If you look into UK and US, so it's between the quantity versus quality, but the court takes it as a reasonable degree of care. That is the care. You can't say that I am going to see a severe case within 30 seconds I will dispose him of. No, it will not be taken very lightly by the court. So that kind of defense will never be taken into account in the court of law. Though the court has acknowledged it, but it cannot be used as a defense, Dr. Ali. There are a couple of questions. is any point in working in a country that openly ostracizes doctor? This is a very, very debatable question. But unfortunately, yeah, I agree that there has been violence against doctor. I do acknowledge, but unfortunately, I get great satisfaction to be in India to treat my own patient because uh, this is the profession I have chosen. But I do condemn violence in any form against any person, including doctors or anything. But it's a personal choice to work in India or not. And one more question has come with Dr. Deepak. I think Deepa, a case of TRS on 300 milligram of clozapine, every visit advising for TLC, but the patient is following up without blood count. Shall I prescribe clozapine or stop prescribing a patient maintaining well? Stop prescribing clozapine, but the patient's maintaining well with 300 stop also can cause relapse. Okay, this is a very good question where the doctor has said that if I'm prescribing clozapine and the patient turns up in front of me without blood counts, and every time I say that, but he doesn't get the blood count done, should I stop the prescription is the question. One, okay, if I go on prescribing and the patient develops aplastic anemia, so who will be responsible? Doctor will be held responsible. So the cost of patient developing aplastic anemia versus a cost of relapse, which is higher? So all textbooks, all guidelines, reasonable degree of care is you have to get the hemogram done. So I would stick to the standard of care that I have to go for blood count. So I will do the blood count, then I will issue the prescription. So this is how the law looks into it. Yes, there, by looking at the human angle, you may say that hemogram is not available in maybe taluka place or a rural place. That may be an argument, or there is an extra burden by getting a blood count done. But our own fraternity, our own guideline says that every month we have to do blood count, and that means we are deviating from the what we call it as reasonable degree of care. That will be held against the doctor. So I'm talking about the law, but unfortunately clinical practice and law may not go hand in hand. That is unfortunate, but we have to be legally safe and then do clinical practice. Let me remind you, one of my teacher in National College used to say, see, medical profession comes with some occupational hazard. It is like a concrete example can be is if you are driving a vehicle, there is a possibility of you meeting with an accident. However, you may be safe driver, but the opposite party may come and cause an accident. So in such situation, it's like a road traffic accident. So the doctor may be very good, but the illness may not follow the what we call it as usual course of action. The body physiology or pathology may not follow. The patient may have some or the other complication. He may have complication or he may die. In that scenario, better to have indemnity insurance. The way whenever you drive, you require an insurance to drive. Similarly, whenever you practice, do have indemnity insurance, because these kinds of mishaps do occur because we are not treating a robo or a computer. We are treating a human being where there will be various ways of difference of behavior. We should acknowledge and go further. And I would like to stick to the standard of clinical practice. That is the question. That was the question. Any other question? One more question. Okay, one more question has come in last minute. Okay, thank you. Okay. Anything done by a patient or omission or commission is not doctor's negligence. So if a patient stops clozapine either actively or passively by not doing TLC, the doctor is not negligent. Is that correct? Yes. If the patient stops his medication on his own and he develops relapse, he will be held responsible, not you. This is according to the schizophrenia you're talking about. Imagine if you are a diabetologist and you have told to do diet, food control, and you have told him to take medicine properly, and he doesn't take medicine, and his glucose level shoots up, and he develops diabetic ketoacidosis. The doctor will not be held responsible. You have prescribed, and he has to follow those advice. If he doesn't follow the advice and he develops some complication of the illness, he will not be held responsible. That's be very clear. And you are supposed to follow the reasonable degree of care. That's what is the final version. So please follow the reasonable degree of care. And again, from the Indian Psychiatric Society, whatever current clinical practice guidelines are there, please follow that, because these clinical practice guidelines, you may call it as copy and paste, but that will be used in the court of law. Though you may bring in American Psychiatric Association clinical practice guidelines, but Indian law will look into the Indian clinical practice guidelines, because our guidelines have been modified to the Indian scenario. So please do give respect to our clinical practice guidelines, especially the local ones, wherever in the Indian is there. And if it is not there, obviously they will go to the textbook or to the international scenario. So again, one more question has popped up. In some hospital, doctors do not follow up their own patient. When patient visit next time, some other doctor has to simply repeat or CST the medication despite irrational combination. What is the implication? Okay, this do happen in various big hospitals where a doctor has seen, and later some other doctors or a junior resident says maybe patient may go to a different doctor, different unit, different day. These do occurs. For that reason, whenever a medical negligence case has been done, what do the patient and his lawyer do? They do is they name the primary doctor who is in charge, and they will say and hospital. If you look at the Kunal Shah and versus AMRI hospital, so it will be taken, they will many a time the doctors may not be named, the hospital will pay for the compensation. If you take the AMRI hospital also, in that case they have given a huge compensation. The doctors were asked to pay a very fraction of the amount, the hospital has to pay a huge amount. So it will be a collective responsibility of the main treating patient, doctor, the patient's behavior, and also the hospital, what kind of doctors the hospital hires. On that basis also, it takes the what we call it as vicarious liability lies on the main doctor and also to the other what we call it as the hospital. So in that way, the whole establishment will be held responsible. So that is the way it has been taken. Is there any guidelines for seeing number of new cases by psychiatrist in one day for OPD for private practice? Unfortunately, there are none. You should know how to practice safely. Obviously, this may end up in a defensive practice. Yes, unfortunately, we are going into that quality versus quantity. They look for quality. This question, when it has been raised in the legal, forum, the advocate is my teacher, Professor Om Prakash Nandimat, who said, if doctor, you are a patient and you go to a doctor, what amount of time do you expect that doctor has to spend with you? Same amount you have to do it. That's what the general answer they have said, but there is no any fixed timing. But however, in UK, US, they have evolved their own timing, maybe 35 to 40 minutes something, where some amount is given for the examination of the patient, another 15 to 20 minutes for documentation, so that the whole thing comes up to around 45 minutes. But that is not at all practical in Indian scenario. But at this point of time, we don't have answer for that. What number of cases to be seen, what amount of time to be seen for each patient is not there, what amount of time to be seen for a new cases, amount of times to be seen in follow-up cases, we don't have any guidelines. But however, over a period of time, yes, that may come up. I think we will, because there are questions are popping up, time is running out. Thank you very much. And you can contact me directly. Also, my phone number is available, and this video will be uploaded for your review on YouTube in another 2 weeks. Thank you very much for your patience, hearing, and your time. Thank you from Telemedicine of NIMHANS, and this class was sponsored by Lanex Laboratories, Chennai. Thank you very much.